What if everything you've been told about glaucoma is wrong? Many believe it only affects older adults or that symptoms must be present for it to be a concern. But the truth is much more complicated. There are 7 common myths about glaucoma that could be putting your vision at risk, and most people don't even realize it. In this video, we're going to debunk these myths and uncover the truth behind this silent thief of sight. You'll learn what truly puts you at risk, how to protect your vision, and the steps you can take now to fight back. Stick around. By the end of this video, you'll have the facts that could save your sight for years to come. Glaucoma is a group of eye diseases that can damage your optic nerve, leading to permanent vision loss. It's often caused by high intraocular pressure, IOP, or the pressure inside your eye. Imagine your eye as a balloon, filled with fluid that keeps it inflated. When too much fluid builds up, it increases the pressure on your optic nerve, slowly causing damage and fading your vision over time. There are 2 main types of glaucoma: open-angle glaucoma and angle-closure glaucoma. Open angle is more common, where the fluid drainage system becomes clogged, raising eye pressure. Angle closure happens when the angle between the iris and the cornea narrows, leading to a sudden rise in pressure. While it may sound complicated, it's really just about how the fluid moves in your eye. Here's a surprising fact: glaucoma is the 2nd leading cause of blindness worldwide, affecting over 60 million people today. It's silent and sneaky. By the time symptoms appear, the damage may already be significant. That's why early detection is crucial. As you get older, your risk increases. People over 60 are at higher risk, and those with a family history are even more likely to develop glaucoma. Our bodies don't always manage eye pressure well as we age, much like an old car that starts to wear down after years of use. Other factors like ethnicity, particularly for African Americans who are more likely to develop it younger, and conditions like high blood pressure or diabetes also raise your risk. So the older you get, the more important it becomes to monitor your eye health. Glaucoma may be silent, but your eye care should never be. The earlier you get tested, the better the chance to prevent or slow down vision loss. But more on that later. Myth number 1: glaucoma only affects older adults. Many people think glaucoma is only a concern for older adults, but that's not entirely true. While it's more common after 60, glaucoma can develop at any age, even in children, though it's rare. The reality is that glaucoma doesn't care about age. There's something called early onset glaucoma, where individuals under 40 are diagnosed, and it's more common than most realize. A study from JAMA Ophthalmology found that 10% of glaucoma patients are under 40. So it's not just a senior's disease. This myth could put younger people at risk who think they're in the clear. If you're under 40, especially if you have a family history or other risk factors, it's important to stay vigilant. Don't wait until you're 60 to think about eye health. Early detection is key to preventing damage and saving your sight. Myth number 2: if I don't have symptoms, I don't need to worry. One of the sneakiest things about glaucoma is that it often has no noticeable symptoms in its early stages. You might feel perfectly fine, but glaucoma could be quietly damaging your optic nerve without warning. That's why it's called the silent thief of sight. The damage happens gradually, starting with peripheral vision loss, your side vision. It's so subtle you might not even realize it. You could go about your day and not notice that you're losing bits of your vision. By the time you see something's wrong, it might be too late because vision loss from glaucoma is irreversible. That's why early detection is crucial. Regular eye exams, especially visual field testing, can spot the problem before it's too late. This simple test measures your peripheral vision and detects any blind spots. So don't wait for symptoms to appear. Get your eyes checked regularly, especially as you get older. Myth number 3: glaucoma is caused by stress or eye strain. This is a common misconception, but let's clear it up. Stress and eye strain are not the causes of glaucoma. You've probably heard that being stressed or staring at your screen for hours leads to glaucoma, but the real cause is high intraocular pressure, IOP, not stress or eye strain. Glaucoma develops when there's too much pressure in the eye, which damages the optic nerve over time. This happens when the fluid inside your eye doesn't drain properly, causing pressure to build up instead of being relieved, which harms the nerve. You might be thinking, doesn't stress cause other health problems? It can, especially things like high blood pressure, but it's not directly linked to glaucoma. Studies show that managing eye pressure with treatments like eye drops, medications, or laser therapy is the most effective way to tackle glaucoma, not reducing stress. So the next time someone mentions stress or eye strain as the cause, you'll know it's all about the pressure inside your eye. Myth number 4, if glaucoma runs in my family, I'm doomed. It's easy to feel like you're destined to get glaucoma if it runs in your family. While genetics do play a role, it doesn't mean you're automatically going to develop it. Think of it like heart disease. Just because it runs in your family doesn't mean you'll get it, but it does mean you need to be proactive about your health. Having a family history of glaucoma means you should be extra vigilant about your eye health, but you're not doomed. Regular eye exams can catch glaucoma early, before it causes significant damage to your optic nerve. The key is staying proactive. Genetics are important, but your lifestyle choices, regular checkups, and early detection can greatly reduce your risk. Studies show that even with a genetic predisposition, early eye exams can help slow the disease's progression. So don't sit back thinking there's nothing you can do. Take control of your eye health. Myth number 5, glaucoma only affects vision at the center of the eye. If you've heard that glaucoma only impacts central vision, it's time to set the record straight. Actually, glaucoma usually starts by affecting your peripheral, side vision. The gradual loss of side vision is one of the first signs that something's wrong with your eyes. It's so subtle, many people don't even notice it until it's already progressed. What happens is, your peripheral vision fades away, often without you realizing it. Over time, this can creep in and affect your central vision, and by the time you notice, the damage might be too severe to reverse. This is why regular eye exams are so important. Visual field tests, which check your peripheral vision, are crucial for detecting glaucoma early before it significantly impacts your sight. Studies, like those from the British Journal of Ophthalmology, show that peripheral vision loss is often the first sign of glaucoma. So the next time someone says glaucoma only affects the center of the eye, you'll know the truth. It starts with your side vision, which is why regular testing is so important. Myth number 6, there's no way to prevent glaucoma. This myth needs to be busted. While we can't fully prevent glaucoma, there's a lot you can do to manage it, slow its progression, and even preserve your vision. The idea that you're powerless against glaucoma simply isn't true. The key is early detection. The sooner you catch glaucoma, the better your chances of preventing severe vision loss. Even if you have high intraocular pressure, a key risk factor for glaucoma, it doesn't mean you'll develop it. Studies have shown that early treatment can significantly slow or even stop the progression of the disease. Treatment options include eye drops, oral medications, laser therapy, and surgery, but the main focus is managing intraocular pressure. By lowering this pressure, these treatments can help protect your optic nerve from further damage. So while you can't fully prevent glaucoma, with the right care, you can manage it effectively. Regular eye exams, following your doctor's advice, and taking prescribed medications can make a huge difference. While you may not be able to control all the risk factors, you can control how well you manage them, giving yourself the best chance to maintain your vision for years to come. Myth number 7, surgery is the only option if you have glaucoma. When people hear glaucoma, they often think surgery is the only solution. But that's not true. While surgery is sometimes necessary, it's not the first choice for most people. In fact, many patients manage their glaucoma with less invasive treatments. The first line of defense is usually medications, typically in the form of eye drops. These drops reduce intraocular pressure, the main cause of optic nerve damage in glaucoma. If eye drops aren't enough, oral medications may be prescribed. Another effective option is laser therapy, which helps drain fluid from the eye more effectively, reducing pressure and protecting the optic nerve. Surgery, like trabeculectomy or drainage implants, is generally reserved for more severe cases where medications and laser treatments haven't worked. But don't worry, surgery isn't the only option. Advances in non-invasive treatments like microinvasive glaucoma surgeries, MIGS, now make it possible to manage glaucoma with less risk and discomfort. So while surgery is one option, it's not the first step. There are plenty of treatments to consider before going down that road. Stay informed, stay proactive, and work with your eye doctor to find the best plan for you. How to protect your eyesight and take action. To protect your eyesight, there's one thing you can't skip: regular eye exams. You might think, I don't have any vision problems, so why bother? But that's exactly the point. Glaucoma is sneaky and often has no symptoms until it's too late. Early detection is key, and regular exams are your best defense. The American Academy of Ophthalmology recommends everyone over 40 get a comprehensive eye exam every 2 years, or sooner if there's a family history of glaucoma. These exams include tests that can detect early signs of glaucoma before you notice any problems. Just like you see your doctor for checkups, your eyes need regular attention too. It's a small effort that could save your sight. Taking care of your eyes goes beyond exams. It's about your daily habits. A healthy lifestyle can have a huge impact on eye health. Start with your diet. Foods rich in omega-3 fatty acids, vitamin C, and vitamin E support eye health. Include fish like salmon, citrus fruits, and nuts in your diet. They're great for both your heart and eyes. Another crucial step: quit smoking. Smoking is linked to glaucoma, cataracts, and macular degeneration. If you smoke, quitting will do wonders for your eye health. Also, maintaining healthy blood pressure is essential. High blood pressure can increase your glaucoma risk, so exercise, a balanced diet, and stress reduction are key. For managing glaucoma, there's no one-size-fits-all solution, but there are many ways to keep eye pressure under control and protect your optic nerve. The first step is usually eye drops, which can reduce eye pressure. If eye drops aren't enough, oral medications or laser treatments may be considered. Laser therapy, in particular, has improved over the years and is less invasive than surgery, offering an effective solution for many people. In more severe cases, surgery may be necessary, like trabeculectomy or drainage implants. But don't worry, medical advancements have made minimally invasive surgeries like MIGS, micro-invasive glaucoma surgeries, a good alternative for many patients. So, stay proactive. Regular exams, a healthy lifestyle, and understanding your treatment options are essential for managing glaucoma and maintaining your vision. Your eyes are precious, and taking care of them today will protect them for the future. Now that you know the truth about glaucoma, it's time to take action. Don't wait for symptoms. Get regular eye exams, manage your health, and stay informed. Have you checked your eye pressure recently? Do you know your family's history with glaucoma? These are important questions because protecting your vision starts with being proactive. If you found this video helpful, please like, share it with someone who might need this information, and subscribe for more health tips. Don't forget to turn on notifications so you never miss our future videos. And keep learning. Click on the next video that appears on your screen for more valuable insights to help you live a healthier life.